Sunil Abbas is the General Secretary of the Society for the Empowerment of the Deafblind, SEDB, India. With his extensive experience as a hardware professional and service engineering, Sunil uses his knowledge to advocate for the rights of persons with deafblindness, ensuring that they have equal access and training to all facilities and assistive devices. Sunil collaborates with organizations and companies developing assistive technology, providing feedback, and ensuring the requirements of persons who are deafblind, deaf, and low vision users are met. Sunil leads and assists employment training workshops and provides direct counseling and support to adults who are deafblind. Fun-loving, hardworking, and generous, Sunil conducts popular awareness drives. He has presented at conferences to raise awareness and advocate for the rights of persons with deafblindness, both at the national and international level. Teresa Anthony is the lead inclusive design at Chetana Trust. Her work ranges from developing and organizing awareness workshops for adults and children, training programs for professionals, accessible play and reading events and activities for children, and managing the complex elements of running accessible library services for the children of Chennai. Her great passion is creating accessible children's storybooks. Her background in visual arts and design, combined with her training on designing access solutions using a range of technology and learning scripts such as Braille, pushed her to innovate and create internationally awarded inclusive storybooks. For the past 5 years, Teresa has worked alongside children and adults with and without disabilities to spread awareness on the importance of accessible imagery that children's stories should hold. She mentors individuals wanting to explore, create, or use accessible storybooks. Thank you.
Good morning, everybody.
Okay. So, hello. I'm Teresa Anthony. I'm joined with Sunil Abbas from SEDB, as you've heard. I'm also joined with Namita, who is the director of our organization, Chetana Trust. She wears many hats, but for today she is the director of our organization, and she drives almost all of the projects that we take up, and she's a massive part of this project and this presentation.
She holds a part-time position as researcher.
So we'd also, the clicker, sorry. Yeah, we'd also like to begin by acknowledging the people who have been a part of this presentation. They are Zamir Dale. He is the founder of SEDB. SEDB is an organization that is started by the deafblind for the deafblind in India, and you will hear more about that from Sunil. Sunil will talk about SEDB and the work they do later on in the presentation. We also, another person who's contributed a lot is Pradeep Sinha. He is a core member of this organization. This is his sign. Pradeep. And Rajesh, who is a tactile interpreter, he was part of the research team, a group of us who looked into a deeper study of technology usage, and we'd like to acknowledge him as well. Okay. So SEDB, this big organization in India that, again, like I said, is started by the deafblind for the deafblind. The leaders of that organization were curious, and they wanted to find out more about their members, the people who are deafblind in India. They wanted to know how restricted are they in India? What are the barriers they face? So many studies came forth from this, one of which is how restricted are deafblind people in India. It was a bunch of questionnaires and in-depth interviews that were conducted in 2020. And from that drove many of the work that happened later. Another important study that happened post this, post the first study that I spoke about, is the role of technology in supporting access. This is part of a larger project conducted by Saksham and FICCI in India. It's a project that was spread across disabilities, and we were given this wonderful opportunity to represent the deafblind community in India. So we did that along with SEDB, and this was done in partnership with them. I'd like to talk a little bit about the first presentation, which was, the first study that was done, which was around how restricted deafblind people are in India. And the findings were quite shocking. The first is that all the respondents expressed the need for interpretation and guide services. They often rely upon their family members or just a friend to help them interpret. So we don't have professional tactile interpreters. And Sunil will talk more about these things. The second was everyone commented on the lack of accessible assistive devices. It was not affordable, and they didn't know about it, and that was quite shocking. They are all adults, and most of them who've acquired deafblindness late in life, they didn't grow up knowing about this technology. So this was something that came through. Another was that employment was a big issue. Once these adults who acquire deafblindness late in life, once they, they'd have a job, but then once they started to lose their vision, they get fired, right? And they didn't know where to go or whom to talk to. They were often just left at home to just sit there and while away time and twiddle their thumbs, and they didn't get another job because they didn't know who to talk to. Another big problem, another big finding was the lack of financial understanding. Like, how do you work? Like, how do you go to the ATM and withdraw money? What is the bank system like? Who can you ask for these things? So I'd like to now invite Sunil to talk a lot more about this entire problem that we have in India. I'd like him to begin by talking about his experience of acquiring deafblindness late in life. He's someone who lost his vision progressively, and so we'd like for him to talk about that first, and then we will carry on.
Complex thing to do, but it was also interesting because we used a platform that was already for digital questionnaires that was already
Before Sunil starts, I just want to say I'm not an interpreter. No? Better? Okay. Before Sunil starts, I just want to say I'm not an interpreter. We don't have an interpreter for this trip, so I'm sort of filling in and feeling very heavy, this responsibility of voicing for a friend. I will try my best, but I ask your patience, and I ask Sunil's patience. Yeah?
And then I've done 10 interviews with office holders at authorities with the responsibility of providing information
everyone.
during the pandemic.
Oops.
And the question to them was more like, what is your assignment in relation to giving out information in times of crisis? What are your resources
Hello, everyone.
when it comes to giving out information? how
My name
much
is
can you
Sunil
target
Abbas.
to certain groups?
And this is my name sign.
And if not, what do you do?
I think it's fantastic to be deafblind. I live in Chennai, and I've come all the way here. I work with SEDB.
In the process of developing the
I go to
questionnaire, as I said, we worked
I flew to Canada.
closely together with
I
the
flew
member
to Canada.
organization and with other experts at, for example, the resource center.
And it's amazing.
Find out, are the questions feasible? Can I
Okay, hang
access
on.
with different kinds of devices if I use my phone? Or
Sunil is mentioning my interpreters are telling me who are in the room
in
right now,
questionnaire
since I
with
can't
a
see,
braille
so they're providing that
reader
visual
and so
access.
on. And it was not perfect, like we would have wanted in the best of worlds, but it was working.
In the past, I was able to see more. Growing up in my country, I was able to see landscapes. So here I am in a big city where there are all these buildings around. I'm unable to see them.
Of the platform, or
But growing up, I made notes of the visual things I was able to witness. I was able to look onto my phone, able to see things around me, and that was more younger age.
example, or so were there headings or not, and things like that. So
As I grew older, my vision dropped, and it became hard for me to see things. I could see almost nothing in the distance.
to make it
It was technology that saved me.
as
I
said
could see
previously,
directly in
the
front
member
of me,
organization
and I
in
could
Sweden,
use my
they helped us
computer.
to send out the questionnaires, and
I
we
could
did
use
that,
my phone.
we did
But
our
over
first,
time,
sending out with
everything
some small information
became
about
less, and my help, my information, everything came through my phone.
questionnaire by
It was
using a link
technology
and so
that was
on.
really
Then we
important for
repeated
me in my
this
life.
Twice. We also
It helped me become
encouraged
really
people who
independent.
wanted to participate, but maybe could not use,
It allowed me to do
the
everything
link
for
and
myself.
could not access online, to be in contact with either
It didn't bother me anymore that I was losing my vision. In fact, it became something that made me happy that I could build awareness about these things.
because then we could provide the questionnaires in a different format.
I want everyone
So there were
to
also
develop
examples
this, I want to spread this message of, I want to spread this message to others who are losing their vision.
Paper. And we could also provide help if someone wanted to answer.
And Sunil finished by saying thank you. Thank you for your time.
Okay, I'm going to hand it over to Namita now.
To text, because I don't read Braille. So we tried.
Okay, this is the other half of me
to
that
adjust.
actually is part of the study.
I don't have
We
the
did
exact number of how
a
many
whole series of
participants
things
with
because
deafblindness,
SEDB did the studies not to make publications, but to really understand what it is that they could do for people who are deafblind.
400 is the figure that
We held in-depth conversations
we have
with
59
groups. We held in-depth conversations with individuals. And the whole process of doing this informed consent, understanding what we were asking, getting information, getting details, getting life stories.
the mean age was 50.
This was incredibly challenging.
We have an age range from 15 to 86.
India is a country of many languages, numerous barriers, and if you throw in a pandemic, it does not make life easy. A bulk of our research was done during the pandemic, when the role of technology became hugely visible to us. And it became urgent for us to understand what we could do to bring change. My organization works very closely with SEDB in helping them develop these questionnaires and processes, understand just concepts of ethics, process, compiling results, sharing. It's been an immensely challenging and exciting journey together. The way we set up the interviews during the pandemic was, I think, a paper all by itself. But what was very visible to us was the reality, the everyday reality, the everyday challenge. Many of them used phones, technology that was very outdated. Many of them didn't know the power of what they were holding in their hands. And one of the big discoveries we made was this first point. The importance, the big difference that we saw when people were exposed to technology early in life, were provided with good education, no-brainer. But we've really, it's really visible in a country like ours. We had people who had early access, who later, when they lost their vision, I mean, Sunil is a great example. He's always been curious about technology, and he's had the benefit of having an opportunity to explore technology even when he was younger, so that when he came up against problems, he could solve them. I can ask him to talk to you about some of the innovative ways in which he solved them. And he's not, you know, he's flipped the wiring system in his house. He's done all kinds of things to be able to accommodate his own need. And we realized that you know, access to great education or high levels of literacy was less important than access to just technology itself. And a great example is another colleague of ours in Delhi. He has developed his own solution, which was taking Christmas lights and winding it around his backpack as he crossed the busy roads in Delhi, holding his stick up, again with lights wrapped all around it, because nobody stops for you in this very busy country of ours. So he would get off his bus, stand at the street corner, turn on all his lights, and walk down the road swinging everything, his backpack, his stick. Everybody stops. You know? So these ideas to figure stuff out and solve your own problem is, yes, partly a person's internal attitude and approach, but it's also a person who's had the opportunity to play with technology. So we saw the barrier, but we also saw the strength within the community. We have people like my colleague in Delhi, and we have people like Sunil, and like Pradeep. These are great gifts. People like them bring brilliant, innovative solutions. The second big area was this of availability and access to assistive technology. We have a lot of problems, and Sunil will talk more about this soon. We qualify, if you're a person with a disability, you qualify for some support from the government to subsidize certain assistive devices. It's tied to how you are perceived by the government. Deafblindness is very confusing for them. And so many of the things that have been developed, many of the supports that have been developed and provided to people with visual impairments, and many of the things developed and provided to people with hearing impairments, a person who's deafblind is sometimes asked to choose, would you like to be this or that? It's ridiculous. Certification, recognition of deafblindness, this is something without which it's going to be hard to move forward at any decent pace. The second part of this is, again, the designers. India is a very innovative country. And we are really the hotbed of where the world's engineers seem to be produced. And we have a very strong social conscience. And right now in India, there is a huge revolution of developing what they call social engineering solutions. And what this means is you use your brains to support your own society. Wow, what a concept, right? It took them years to get there. But now that they're there, it's been brilliant. In the last 5 years, I'll say the scene has changed tremendously. We have so much of AT made in India. Really good, really, really good. And amazingly cheap if you think of buying the same thing or similar things anywhere else in the world. It's really high quality. And I'm very critical. So trust me, when I'm saying it's good, it's really good. We have some marvelous people. We meet every year in October, and we really push for solutions. Well, again, what you'll see is a huge body of work that's happening around visual impairment, a huge body of work happening around hearing impairment, and nothing that ever considers the possibility that you will be deafblind. Having someone like Sunil attend a conference like this and directly engage with the developers has been game-changing. They go in, they assess the technology, they comment on the technology, and they really, really, really push for change. We'd like to see this improve, and I'm sure Sunil's going to talk about this as well. The last is this idea of the availability of trainers. COVID really increased the visibility of technology, assistive technology, and its importance to provide access to people with disability. And there are a lot of organizations in our country where they focus on making this technology available and tying it to training and repair. Two very big reasons why technology is abandoned. But it's for the blind, most often. Few things for the deaf, very few. And neither of them accessible to a person who's deaf, low vision, or deafblind. Again, people like Sunil come up with fixes to the glitches. And having him as a trainer, for example, is brilliant, because it isn't about learning how something functions and passing that skill on. It's having someone like Sunil who has humongous capacity to fiddle and solve problems even when he doesn't have the right technology. So when Sunil trains, he trains for the reality of today and is able to really match it with a person's need. If you were at our earlier presentation, we shared a quotation from, the answer to a question from one of the participants of a training where Sunil was the trainer. She is someone who is deaf, born deaf, and is in the process of losing her vision, but is at that point where she has enough of vision to think it may never happen to her. It may never get worse. I'm going to coast through life without really having to deal with terrible things like canes and braille and, other stuff. So she's not ready inside herself at that point until she met Sunil. And when she met Sunil, he said, well, how do you do this? Does this ever happen to you? And sort of chatted with her and showed her how he solved some problems. And before you know it, she's learning all kinds of things, making all kinds of changes, and willing to listen to how to make her life better today and plan for tomorrow. When I spoke to her after she did 2 sessions with Sunil, she said how he was able to see the world through her eyes, how he was able to imagine things that would be difficult for her and fix it, how he was able to find solutions for problems that she said, I never thought it could be solved. But he solved it. This is something we want to give our country. We want to develop Sunil's capacity, other deafblind colleagues who have this instinctive, amazing ability to really develop it, systematize it, so they can offer this level of support to this huge community that's left out. I want to use the rest of this time to ask Sunil to tell us what is his dream, what would he like to see happen? How does he think we can bring change to the lives of people with disability, with deafblindness in India?
As this is being signed to Sunil, I just want to clarify. Earlier, when Sunil was talking about his love for technology, he said that as he travels around Canada now, he loves his phone because he can use it to zoom in and look at all the things that are around, and that makes him really happy, the fact that assistive technology allows him to do this.
During the time of COVID-19, in providing care to older Canadians with deafblindness. So we did an online survey with 229 healthcare providers, and then finally I asked those healthcare providers to, if they're willing to share more of their story, details. So then out of those 229 healthcare professionals who participated in this study, 22 of them agreed to share more data, share more stories, right, that what happened and what worked, what did not. That was that part. So today I'm taking this because again it will be too much to present all of this in 10 minutes. So I'm basically going to give you a snapshot.
Long before SEDB,
session today.
deafblind people. Oh, wait, 1 second.
Existing challenges in continuum of care. So I think I'll start with the first point is client-provider communication. So communication, we all know how critical it is for deafblind individuals. So communication, healthcare communication between the care provider and them was the most challenging aspect. And we all know how, I'm pretty sure, though I'm talking about all these challenges,
Can you tell him to start
relate
again?
to your
I
own
need to
work.
see the
You have
video.
seen those challenges.
I don't think he's talking about himself, he's talking
nothing
about,
new. But if you ask me specific question,
he's
I
talking
can
about
give
people
you more
at
examples
SEDB.
there. Then lack of training, time and comfort. I think healthcare providers, they
Josh,
have
you have to stop.
They have a very tight schedule. They have to fit everyone, and then they might not know this particular older patient who is coming to see them. They have dual sensory loss going on, so they were not prepared for that. And then they have to squeeze in whatever best they could do. So that's what was happening. And then they also were not trained how to communicate with them. Because if they are not aware of the accessible formats, if they are not aware of the different healthcare communication, like how to communicate with individuals.
In SEDB, I've researched.
Every person is unique. Every person who with deafblindness is unique.
There are so many people who start out as deaf.
A bit of a challenge for both the parties. So that's what was one main thing. Lack of comfort.
But deafblind, they don't get it.
They see, oh, this particular person is difficult.
They think deafblind people can do nothing.
With me. What's wrong? And
You're not the same as me. I can understand people who are deaf, but deafblind people, you can't do anything.
That complicate the whole scenario.
If you have low vision, you can work, you can live life, you can make money,
People assume that you know how to go about
you can earn a salary. But over time,
I think we need to change that whole conversation that how can you
yeah,
assume
I will reject you. When your vision drops, then you get rejected. You get stuck, you get placed in your house, you can't go out, you have nothing to do, your life ends. So people think this way, they get dejected. When SEDB started in 2015, they started advocating. They registered themselves and they had started fighting. They fought for deafblindness to be identified.
So stories are really different. People who have seen this world,
to spread awareness about deafblind, and we started asking, we started talking to people and saying, deafblind people, join us, come together, SEDB, we will fight for you. It's a society for the empowerment of the deafblind. Join us, come under our banner.
they were not there anymore because everyone was trying
We
to remain in their own own social bubble which is safe for them. There was a fear of
We started talking about the importance of technology.
so all these sort of things
We
were
encourage
complicated
people
from
to
our
learn
side, and within that telehealth was introduced. So
and advocate for them to get more technology.
healthcare accompaniment
We want them to increase their skills so they can work
for a person with deaf blindness to have someone with them as
and
a
get
healthcare
better
accompaniment
pay.
when they are
We advocate with the government so that they may see people who are deafblind and they can understand that they have skills
they might not play a big role in communication, but
that they can develop.
to help, they are there to navigate. But
They are
suddenly during
surprised.
COVID-19,
They're always surprised. Yes, you can be deafblind and you can work.
policies change, healthcare accompaniment
The
policies
companies
sort of
accept
regulated,
us,
so
give us
not everyone can
jobs.
go,
We can do a
only
great
patient will
job if you provide skills first.
of a challenge
Then
for
anything
those
is
people.
possible.
And
If
then
you give the right
access to
technology,
information that I think
they
Dr.
develop
Noah
the
just
skills
talked
to
about.
use it.
The access to information
Yes,
is so
it will.
critical. Public
And
health
SEDB
guidelines
tries to
were
help
just
them
rolled
develop
out
these
without
things.
thinking whether it is reaching to our audience with
So
deaf
we've been
blindness at the
going
right point of time and in the right
from
way.
company to company, organization to organization, asking to help us develop a center so that we can work in this area.
The
But
most
we
important
have
stuff that I
no
want you to
chance.
take away, and I would say that it's not coming from
We've
like,
been
this is coming from
advocating
research, but
all
I think I
over
want
the
you to
place,
advocate. I want you to
asking for a
advocate whenever you
center,
get a chance
asking,
to see
talking to deaf
and sort of to
groups,
speak about
inviting
deaf
people
blindness
to
and
see
speak about
us.
healthcare with us.
We want to be able to invite people to come together, develop skills.
So the first thing, accessibility
We
of
want
clinical
to have
setting and
a place where they can learn technology, when they can experience these things, they can learn tactile sign language,
access to information with respect to our people
and
who are
really
deaf
have a
blindness.
better
So
life.
I think healthcare and deaf blindness, I think a lot has to, we need to do a little bit more with respect to our research work in the space of healthcare access and rehab care access. So I think that's what would be
SEDB, the founder of SEDB is this gentleman called Zamir. He is deafblind. He's a great advocate. He's done so much of advocacy in our country.
put in place to ensure that the person
Me,
is prepared
Sunil,
before they went into this clinical setting.
I'm the general secretary.
That how to navigate this building, how to navigate this clinical setting.
And we've both advocated for technology. We want to empower people all over India. We want to empower the
It was
deafblind.
changing so fast, and then maybe those information, if they were not given, then
Yeah.
when
Thank you.
when you can allow someone to come in and when you cannot, when people are not allowed. To our deaf blindness, that was a very big, I think, challenge for both parties. Reliable health.
Okay.
I think we
He's asking if we can, if he can have feedback or questions.
then
Yes.
yeah, you should allow them to have a healthcare component. Okay, yeah, sure. And then finally, training on dual sensory loss specific care. I think the more we communicate about deaf blindness, the more
Hi, my name's Sarika. I'm from Ireland. We talked a little bit earlier on. Sunil.
we get aware. Doctors, nurses, pharmacists, I think
My name's Sarika. Can you hear me now?
and dual sensory
Yeah.
loss and how people
I'm from Ireland, and me and Sunil talked a little earlier on. I don't really have a question, more just comment. I was really inspired by your talk today. There's a lot of similarities with issues you're having in India with what we're having in Ireland. Part of my role is outreach, so I visit people at home and I'm seeing them, create things, kind of assistive technology themselves, and sometimes these aren't the safest things, but this is what they're doing to, make their life easier and make their life kind of more independent. But it's just, I think we could work together maybe in a way and share experiences, because we definitely have some similarities, although I would say the roads in Dublin aren't as busy as the roads in Delhi.
patient who's coming in
Thank
seeing
you.
me. So these are the 4 important things, and then finally, with conclusion, I would say that we need to do more with respect to research, and we need to advocate whenever we get a chance. So we need to talk about deaf blindness, the challenges, unique challenges that these individuals have, and then how we can be alive.
I think SEDB must advocate for children. They must be in schools. They must learn to write and do Braille. They must learn early. They must learn tactile sign, not just speech. All these things together Yes, this will help you later in life. If anything changes, it'll be fine. You lose one, you have another way. This is the best. This is what, yeah, this is what we'd like to see. So I want to be able to advocate for this. I want the law, I want to advocate for this to be added into the law.
We know that older population is changing here, and we really need to advocate more for them. So that's what I'm doing. And
Just to respond to what you're saying, I think this has been something we've heard again and again, and it's been really great. We fought a lot to be able to come to this conference. We really, really wanted to hear. I think when you are in your country, you think you have the worst situation. It's sort of calming, but also terrifying to hear that other countries, countries that we think have everything or have much more, have very similar situations. And it really means that we need to come together and fight louder, fight harder. We had the pleasure of connecting with the Deafblind adult group in Australia, and this was marvelous because, again, as you said, there is so much shared in that journey.
And I also want to say that I have two collaborators.
I want to share also that the registration itself of the organization was already a challenge, continues to be a challenge, as the regulations change every year and the information provided is not very accessible, even to sighted hearing people. I run my own trust, so I can tell you that. So the challenge of just surviving has been enormous. It should be a group that's celebrated, and instead they struggle.
So for the background, persons with deaf blindness need lifelong support to be able to be active and involved in their everyday life. If support is not provided, the results might be negative, resulting in physical and mental illness.
In our law, in the national law on disability, there are many, many disabilities. We are stuck under the category of multiple disability, and this is wrong.
This study that we did was part of a
The
large
deaf,
project
we are not deaf-blind, so we don't fit there.
and it was an initiative,
We think that deaf-blindness should be its own category. This is something I want to fight for. This is then the best solution.
different parts. One was a mapping of the support given from rehabilitation settings, deaf-blind units, all across Sweden.
Are there other
21
questions or
regions.
comments?
Asking professionals what resources and so on that they have to provide support.
I think we are already out of time.
This study, I'm going to tell you about